let's talk about the procedure, how exactly it is done. The autologous active specific immunotherapy preparation protocol involves drawing blood or the tumor tissue from the patient to produce 30 vials, 1.1 milliliter each of the active specific immunotherapy vaccine. The standard protocol for one course of ASI therapy consists of 30 vials administered via subcutaneous injection of one vial on each alternate day, every other day for the duration of 60 days, with a resting period of 3 months between treatment courses. However, it is also possible to extend the protocol, one course of treatment, to 45 vials. In that case, it will take 90 days of treatment. The treatment of allergic disorders and autoimmune diseases requires 30 ml of blood to be drawn from the patient using 3 10 milliliter syringes, which are labeled with the patient's name, date, and patient's data, name and date of birth. The syringe is stored at a room temperature and in the upright position with the plunger facing downward. The waiting time of sedimentation of red blood cells and formation of the buffy coat layer should be visible within 3 days. However, collected blood samples can be stored at 4 degrees centigrade for a longer storage, if you need to store it longer than 3 days. Blood samples are collected by authorized lab personnel for the ASI therapy processing. Specimens are then used for the preparation of either 30 vials of ASI vaccine or, in some cases, of production of up to 45 vials of ASI vaccine. I want to demonstrate how it is all done, with the blood like this. And there is an alternative ASI preparation when the tumor tissue itself is used. As an alternative to vaccine preparation from the tumor specimen, the patients, as an alternative to the preparation from the patient's autologous blood, the tumor specimen can be used. And this method is widely practiced by FCTI laboratories as well, which is conducting research and development and manufacturing of these autologous active specific cancer vaccines. For cancer treatment, in case if the tumor tissue is procured for the preparation of the ASI, it is approximately from 5 to 10 grams of the tumor tissue should be used. But the condition is that it has to be done prior the radio chemotherapy, because if it is done immediately after chemoradiotherapy, the actual nature of the tumor and the tumor cell has been somewhat changed, skewed, so it might not be that effective. So it's preferably the collection of the specimen should be done prior the chemo or radiotherapy. So in other words, if it's the surgically removed tumor, this tumor should be used, the pieces of this tumor tissue should be used in those cases which did not receive neoadjuvant therapy. Okay, so when there was no chemoradio given prior to the surgery, then this method can be used. If there was neoadjuvant chemoradio, especially radiotherapy, then not advisable. It is not the ideal optimal conditions, because the nature of the tumor cells, the antigenic set can be changed, can be affected by the chemoradiotherapy, and that may reduce the efficacy of the subsequent treatment. So the tumor samples are collected by same authorized lab personnel, delivered to the laboratory at 4 to 8 degrees Celsius within 12 hours. Yeah, so in this case, within 12 hours. What to expect? The expected outcomes of the active specific immunotherapy. The ASI helps to overcome and prevent conditions caused by immunity imbalance, such as autoimmune disease, allergy reaction, and cancer, by inducing the production of anti-idiotypic antibodies that neutralize and inhibit the secretion of autoantibodies, thereby maintaining a balanced immune modulating network. One of the main advantages of anti-idiotypic antibodies is that they can selectively inhibit the specific autoantibodies that are complementary. In contrast, most conventional drug and immunotherapies are non-selective and suppress protective and destructive immune responses, making individuals susceptible to a higher risk of infectious diseases caused by the opportunistic pathogens. In addition, anti-idiotypic antibodies induce a memory response by generating T helper memory cells that persist after treatment and prevent relapses from occurring, thus promoting longer-lasting immunity. Active specific immunotherapy is therefore an alternative to immunosuppressants in management of immune diseases. Since anti-idiotypic antibodies are naturally present in the body and the immune response evoked mimics those caused by nominal antigens, they are safe and relatively without toxicity. Additionally, incompatibility issues and the risk of rejection of the recipient is practically non-existent, since anti-idiotypic antibodies are obtained from the patient itself. So we're talking about the autologous active specific immunotherapy. Anti-idiotypic antibodies have been reported to work in people who do not respond well to conventional treatments, giving them a better quality of life, significantly reduced pain, much better pain control, much less fatigue, and as a result, a longer life expectancy. Thank you very much for your attention. Once again, European Wellness Academy brought to you this lecture. Stay healthy, be alive, have fun.